Let us discuss the 5 forces or the kind of pressure that is used to mobilize the tooth. First is the apical pressure, then is the buccal, then is the lingual, then you have a rotational force and the tractional force which is used to deliver the tooth. This is a diagrammatic representation. Here is the diagram of a maxillary incisor. Okay. If you can see, we spoke about the 5 forces to be applied. The first is the apical force. When you use the apical force is when the principle of wedging comes into play, right? Then, as you can see, the thicker arrow on the buccal side means that you apply more force on the buccal side, and the thinner arrow on the lingual side means you apply less pressure on the lingual side. What you are doing here is the expansion of the bony socket. You are giving buccal pressure and a little lingual pressure, buccal and a little lingual. This causes the expansion of the bony socket. Then is your third rotation force, that is the rotation force where you will sever the periodontal ligaments from the teeth, right? And then that is your tractional force or the force used to take the teeth out. So, this is your maxillary, anterior and the lateral. Then you have the canine. What is different about the canine? When you engage the canine, again the first force used is the apical force, as you can see, but before you do the expansion of this bony socket, you have to first rotate, give a rotational force and free the teeth from the pedial ligaments. Then you apply the buccal and the lingual force, again the buccal being more and the palatal being less. This is followed by the rotational force in the opposite direction and then the delivery of the tooth.